Please consider these recommendations from Health Canada when you are planning a transaction. How coronavirus spreads. Human coronaviruses cause infections of the nose, throat and lungs. They are most commonly spread from an infected person through respiratory droplets generated when you cough or sneeze. Close, prolonged personal contact, such as touching or shaking hands. Touching something with the virus on it, then touching your mouth, nose or eyes before washing your hands. Current evidence suggests person-to-person spread is efficient when there is close contact. Preventing coronavirus. At this time, there is no vaccine for COVID-19 or any national health products that are authorized to protect against it. What if you have traveled to an at-risk area? If you have traveled to Hubei Province, China, Iran or Italy in the last 14 days, limit your contact with others for 14 days, starting the day you began your journey to Canada. This means self-isolate and stay at home. Contact the public health authority in your province or territory within 24 hours of arriving in Canada for advice. If you have COVID-19, reduce contact with others. If you are sick, the following steps will help to reduce contact with others. Stay at home and self-isolate, unless directed to seek medical care. If you must leave your home, wear a mask or cover your mouth and nose with tissues, and maintain a 2-meter distance from others. Avoid individuals in hospitals and long-term care centers, especially older adults and those with chronic conditions or compromised immune systems. Avoid having visitors to your home. Cover your mouth and nose with your arm when coughing and sneezing. Have supplies delivered to your home instead of running errands. Supplies should be dropped off outside to ensure a 2-meter distance. How being prepared is important. It is important to know how you can prepare in case you or a family member become ill. Should you self-isolate versus self-monitor? There is a difference between advice to self-isolate and advice to self-monitor. You should self-isolate if you have been diagnosed with COVID-19. Local public health has identified you as a close contact of someone diagnosed with COVID-19. If you have not been diagnosed with COVID-19 or identified as a close contact of someone with COVID-19, you may be asked to self-monitor. What this means. Monitor yourself for symptoms of respiratory illness such as fever, cough, difficulty breathing. What if symptoms develop? Stay home. Limit contact with others. Contact local public health, and follow their instructions. Do proper hygiene. Proper hygiene can help reduce the risk of infection or spreading infection to others. Wash your hands often with soap and water for at least 20 seconds, especially after using the washroom, and when preparing food use alcohol-based hand sanitizer if soap and water are not available. If you are coughing or sneezing, cough or sneeze into a tissue or the bend of your arm, not your hand. Dispose of any tissues you have used as soon as possible in a lined wastebasket and wash your hands afterwards. Avoid touching your eyes, nose, or mouth with unwashed hands. Clean the following high-touch surfaces frequently with regular household cleaners or diluted bleach: 1 part bleach to 9 parts water. Toys, toilets, phones, electronics, door handles, bedside tables, television remotes. What about wearing masks and when to use them? If you are a healthy individual, the use of a mask is not recommended for preventing the spread of COVID-19. Wearing a mask when you are not ill may give a false sense of security. There is a potential risk of infection with improper mask use and disposal. They also need to be changed frequently. However, your healthcare provider may recommend you wear a mask if you are experiencing symptoms of COVID-19 while you are seeking or waiting for care. In this instance, masks are an appropriate part of infection prevention and control measures. The mask acts as a barrier and helps stop the tiny droplets from spreading when you cough or sneeze. Risks of getting coronavirus. At this time, the Public Health Agency of Canada, PHAC, has assessed the public health risk associated with COVID-19 as low for the general population in Canada, but this could change rapidly. There is an increased risk of more severe outcomes for Canadians aged 65 and over, with compromised immune systems, with underlying medical conditions. While a COVID-19 outbreak is not unexpected in Canada, our public health system is prepared to respond. FAC, along with provincial, territorial and community partners, continues to reassess the public health risk, based on the best available evidence as the situation evolves. The risk to Canadian travelers abroad will vary depending on the destination, as well as the person's age and health status. There are some destinations where the Government of Canada recommends avoiding all travel or all non-essential travel. Check the latest travel health notices often before traveling. As well, the risk for COVID-19 may be increased for certain settings such as cruise ships, heavily affected areas, international conferences and other large gatherings in enclosed spaces. It is important for all travelers to self-monitor for symptoms of COVID-19, fever, cough or difficulty breathing, for 14 days after returning to Canada. Avoid places where you cannot easily separate yourself from others if you become ill. If you have even mild symptoms, stay home and call the public health authority in the province or territory you are in to inform them. They will provide advice on what you should do. Canada will continue to adapt our risk assessment based on the latest data available. What about products shipped from China? Coronaviruses generally do not survive on surfaces after being contaminated. The risk of spread from products shipped over a period of days or weeks at room temperature is very low. There is no known risk of coronaviruses entering Canada on parcels or packages coming from affected regions in China. What about animal-to-human infection in Canada? There is currently no evidence to suggest that this virus is circulating in animals in Canada. It is possible that some types of animals may be able to get infected with COVID-19, but it is not yet clear whether they would show symptoms. There are still many unknowns about COVID-19 and this is an area that remains to be studied and understood. Until Health Canada knows more, if you have been diagnosed with COVID-19 and have a pet or other animal, avoid close contact with them, do not snuggle or kiss them, or let them lick you, sit on your lap, or sleep in your bed, avoid coughing and sneezing on your animals. Have another member of your household care for your animals. If this is not possible, always wash your hands before touching or feeding them, limit your animal's contact with other people and animals. This may mean keeping them indoors. These recommendations will be updated as more information becomes available from Health Canada. What about animal-to-human infection in other countries? The current spread and growth of the COVID-19 outbreak is mainly associated with transmission from person to person. However, experts agree that the virus likely originated from bats and may have passed through another animal source, currently unknown, in China before being transmitted to humans. It is recommended that individuals who travel to an affected country or region avoid contact with animals and animal products. This includes wild meat and markets that sell fresh meat, fish, produce and other perishable goods. If you are considering travel, check the latest travel health notices for the most up-to-date travel advice prior to traveling.